I'm Yvonne Zurinsky. I run the Central Coordinating Unit of the Partnership Centre. Elizabeth talked quite a bit about patient-centred care and involving patients in decision-making. And our next speaker is Lord Tim Benson. And you'll notice that he is a lord. He is not a mister or a doctor or a professor. And I hope he'll say something about that. So that's a very special title. So Tim has a story to tell about his own experience with being diagnosed. He also brings in a perspective from his friend. And it's really useful to hear from Tim about how his friend experienced the same sort of diagnosis, but at different times and in different circumstances. So Tim has been a health consumer advocate for almost 20 years, and he joins us from WA to share his personal experience. Please welcome Tim.
Oh dear. Good afternoon. As Yvonne said, let's get this title thing out of the way. I own a small parcel of land in the United Kingdom, which comes with a title, which I avoid like the plague. But you copped it anyway. So moving on from that, as Yvonne said, I do come from Perth, and we're no different in Perth to people in the rest of Australia, contrary to popular opinion. We live on different land. We live on Whadjuk land from the Noongar Nation, but and we respect those elders of that community in much the same way as people here in Sydney, respect their heritage, because I think it's really important. I've been around health consumer activism for something like just over 20 years. And if I can get the slide to change. Yes, here we go. So what have I learnt? What have I done? It's 23 years is a long time. But what I wanted to talk to you about today is a tale of two prostates. Yep. It's my story, and as Yvonne alluded to, it also intersects with a friend of mine who, for the purposes of exercise, I'm going to call Michael. And he didn't receive regular screening, intervention, or prompt treatment. And it sort of brings me to thinking, well, would his story have been different if he had? Or would my story have been different if I hadn't? And so let's talk about it. Do you need a project management degree? I'm sorry, I just need to put my notes because I changed them in the hotel this morning. But some of you in the room will remember the Australian comedians Roy and H.G. Nelson from the late 80s, 90s, and they had a philosophy which they spouted quite regularly of when too much is barely enough. And I think that's probably something that we need to be thinking about today. The average layperson, and I probably don't regard myself as the average layperson. I think I'm probably a little bit more au fait with the system than lay people generally. But I was talking to Yvonne earlier on, and she's also very health literate, but she has her own tale to tell of what happens when you don't push the barrel. So, where does my story start? My story starts, and I'm a person who hates lots of dot points on slides because half the time you can't see them, and the rest of the time you forget what they say anyway. So my story doesn't have any dot points. It's filled with pictures. And Dr. Kathy Nixon was my GP back in the mid-1990s. And she was the one who really got me perhaps going into, was I having, or into a regime where I was getting regularly tested. It started out because I went to see her because I had an itch. And her preliminary diagnosis was type 2 diabetes. So she then conducted tests, and that was the outcome of that visit. So then we undertook a regime of 6-monthly monitoring for the diabetes. And you might say, what's this got to do with the tale of two prostates? Well, that's coming. Because having got into this model of having the tests for diabetes, she then decided she was going to include annual screening for other health conditions. And at this stage I was, mid-40s or something. So she decided that in amongst all that she was going to do PSA tests, which, for those of you who don't know, is a test which is done to see what your prostate's up to. For those of you who don't know what a prostate is, I'm sure someone will tell you. Now, so what happened next was I moved, and with moving came a new GP, and this was in the 2004-ish time, but we continued our annual screenings, and for many, many years things were happy and normal and not a worry, until my notes say August 2917. That's not right. I think it was probably 2017. One of my PSA results came back elevated. Only slightly, but being the sort of person I am, I decided that that was the time that I wanted a referral. I wanted to go and see a specialist. I didn't want to do nothing, because my friend Michael, a couple of years earlier, had all sorts of problems, and we'll talk about those a little bit in a minute. So, with some pushing, my GP referred me to a urologist. Now, that probably doesn't sound particularly exciting. There you go. Those of you who didn't know what a prostate was, there it is. So the urologist sent me for a biopsy. Not a very exciting process, but the outcome, having had this biopsy conducted, was that 7 tumour locations were identified with Gleason scores, and that's a measure of the degree of problem, averaging around 7, and the tumours averaging around grade 4. What that means isn't really important, other than that it's important to do something about it. And so this is my urologist. So having had this biopsy done, we sat down to talk about the options, and this is where the to treat or not to treat comes into it. Because basically there are 4 options. One is to wait and see if it gets worse. It's not going to get better by itself. The second option is to remove the prostate. Third option is traditional radiation therapy. And the last option is targeted radiation using what at that stage, and still is a fairly relatively new device called a CyberKnife, which is actually a very finely targeted laser. And we talked about the pros and cons. And I guess this is where you sort of think, well, I can just wait. Or I can go to the other extreme and have the removal, or look at something in between. And we talked about cost. We talked about incontinence. We talked about erectile dysfunction. We talked about bladder and bowel irritation. You can tell it was a really stimulating conversation. And mostly we talked about my friend Michael's experience. And the outcome of that discussion was they were all reasonable treatment options. They were all clinically okay. And the outcomes were all potentially going to be an improvement for me. I wasn't quite satisfied at that point and felt I needed some more advice. So we went to see an oncologist, and there are some males in my medical life. And Colin was the oncologist I went to see. He works in the public system in WA Health with what at that stage was the only CyberKnife in Australia. So we talked again about the options, and they were the same options, you know. But having finished that discussion and thinking about the discussion I'd had earlier with Elaine, the urologist, I decided that the CyberKnife seemed to be the least invasive, other than doing nothing. And I know what happened to Michael, who did nothing. So back to the urologist, in for a day procedure to have some marker beads inserted around the prostate area to make it easier for the CyberKnife to do its work. Here is a CyberKnife. This little bit up on the right-hand side is the laser, where the laser beam comes, and it moves around your body while you're strapped into something that looks a little bit like the cage they put Hannibal Lecter in. So over 2 weeks, I went for 5 sessions with the CyberKnife. Each session was about 20 minutes, of which about 2 minutes was actual treatment, and the rest was being twisted, turned, and whatever else to get me into different uncomfortable positions. So we then monitored it. We monitored it at the 3-month mark. We monitored it at the 6-month mark. We monitored it at the 12-month mark. And then we continue to monitor annually. Now, is that monitoring too much? Is that something that we can say because monitoring and testing are still treatments? You know, they're still things that take up time, they still have a cost component, and they're stopping somebody else who may have some treatment needs from being treated at that particular moment in time. I don't think they are too frequent, and this is where I guess this is going, because if I look at, this is me, I look happy. I had a pretty good outcome, and I had this treatment very early in the piece because I had for 12 years or something prior to being diagnosed been tested on a regular basis. So I'm still not sure whether that's too much testing or not. But one of the things that was going on in my mind was that my mate Michael, and I'll briefly touch on his story, he'd been having annual tests since 2006, and they were pretty steady. In July 2010, they just went up crazy, and then he was having regular tests. By 2016, they'd reached 12.8, which is ridiculously high. He went to see a urologist, and he now has ongoing problems. He has ongoing incontinence, he has ongoing ED, and it was just a terrible experience from not being tested and from waiting too long. I don't know whether being tested is too much treatment, not enough treatment, or whatever, but I think it will stimulate some discussion today. Thank you.
Thank you, Tim, so much for your story, and I'm sure it will stimulate a lot of discussion. I think it provides a really important perspective from a consumer point of view.